Making an unoccupied bed. Good day, learners. This presentation will deal with the making of an unoccupied bed. Bed linen is usually changed after the bath, but some institutions change linen only when soiled. If the patient can get out of bed, the bed should be made while it is unoccupied to reduce stress on the patient and the nurse. This presentation will assist in your preparation for assessment. Purpose: making an unoccupied bed is a generic basic nursing care standard to be mastered by all learners. The purpose of this presentation is so that the learners skilled in this standard will be able to understand the principles of making an unoccupied bed, demonstrate the ability to make an unoccupied bed, and consider the patient's comfort. Specific outcomes. Learners who have been assessed and found competent in making an unoccupied bed will have achieved the following specific outcomes and will be able to ensure the safety of the nurse throughout the procedure, prevent cross-infection throughout the procedure by handling clean and dirty linen in the correct manner, embedded knowledge. Embedded knowledge represents what you as a learner has to understand and be able to explain in the area of learning and at a particular level. You as the learner should have mastered the theory related to making an unoccupied bed. You should know the medical legal aspects related to making an unoccupied bed. And you should have attended a demonstration in simulation on making an unoccupied bed. Range statement. Making an unoccupied bed is a generic basic nursing care standard in which you, as the learner, can be assessed in your field of learning in line with the subject matter expertise. Procedure. This procedure will be performed according to the nursing process. Assessment. Identify the patient. Greet the patient and introduce yourself. Ask the patient to state his or her name. Check the patient's name and identification number on the patient's identification bracelet. Compare the patient information with the patient's records. If the patient cannot identify him or herself, verify the patient's identification with a second staff member who knows the patient as a second source. Assess whether it is an appropriate time to make the patient's bed. In other words, bed making should not be performed during meal times or during doctor's rounds. Assess for any precautions or activity restrictions for the patient, for example, oxygen therapy and/or surgical procedures. Check the patient's records and nursing care plan for limitations on physical activity. Please note, appropriate nursing diagnosis may include risk for impaired skin integrity, impaired physical mobility, risk for activity intolerance, impaired bed mobility, and impaired transfer mobility. If any of these nursing diagnoses are relevant, the patient may not get out of bed. You will then make an occupied bed. Before you begin to change the linen, first check for evidence of any body secretions or fluids on the linen. If any is present, put on disposable gloves before changing the linen. Planning. After you have assessed all the relevant elements, proceed to assemble the following equipment. Have ready a dirty linen bag or linen trolley, disposable gloves, pillowcases. Usually 2 would do. A bedspread or duvet, a blanket, one large flat sheet, a waterproof cover, which may be optional, or use a linen saver, a drawer sheet, which may be optional, and one fitted sheet. If a fitted sheet is not available, use one more large flat sheet. In this presentation, we will make use of a flat sheet. And a clean chair or any other clean surface except the overbed table. Please note, place the clean linen on the clean surface in the exact order it will be used to make the unoccupied bed. Assist the patient out of the bed. The patient may sit on a comfortable chair inside the room, or the patient may leave the room while you are making the bed. We will now advance to the implementation of making an unoccupied bed. Perform a social hand wash. If the patient's linen is soiled, put on gloves and use a plastic apron to protect your uniform and prevent cross-infection. Adjust the bed to a high position and lower the side rails if required. Place the bed in a flat position. Check the patient's bed for any of the patient's personal items that might have been hidden in the patient's bed. For example, eyeglasses, cellular phones, a wristwatch, dentures, or any other personal articles. Remove any items found and place neatly in the patient's bedside locker. Separate the call bell system from its position on the bed. Loosen all the linen as you move around the bed. Fold the linen that will be reused, such as blankets, bedspread or duvet, and place it over the back of a clean chair or on the clean surface used. Remove the linen items individually and place directly into the dirty linen bag or linen trolley. Please note, always keep used linen away from your uniform and never place used linen on the clean chair or surface or on the floor. If necessary, shift the mattress up to the head of the bed. If the mattress cover is soiled, clean it according to the internal policy of the facility before applying new sheets. Remove your gloves if any were used and discard it correctly. Using the clean linen, make the near side of the bed. Place the bottom sheet with its center fold in the center of the bed. Open the sheet in the length of the bed. Open the long side of the sheet towards you and let it hang over the edge of the mattress. Fan fold the other half of the sheet to the center of the bed. Before we go any further, I will briefly discuss how to fan fold. Grasp the long side of the linen with both hands. Fold the linen about 5 centimeters inwards, away from you, and then under and above. If used, place a drawer sheet with its center fold in the center of the bed on top of the bottom sheet. Open the drawer sheet and fan fold to the center of the mattress. If a waterproof pad is used, also known as a gimme, place it on top of the bottom sheet before placing the drawer sheet. Place a bottom sheet over the corners at the head and foot of the mattress and fold the corners of the sheet. Let me show you how to fold the corners step by step. Lift the long side of the sheet closest to the corner of the mattress with one hand over onto the bed. The sheet fold should form a 45-degree angle on the corner of the bed. Hold the sheet fold firm on top of the bed. With your free hand, tuck in any part of the sheet that is hanging below the mattress. Bring the sheet fold on the bed over the edge of the mattress. This is referred to as an envelope corner. Pull the drawer sheet lightly and tuck it securely with the bottom sheet under the mattress. Continue to the other side of the bed. Open the fan-folded linen and straighten them. Follow the previous steps for folding and tucking the bottom sheet and drawer sheet. With the wrong side up, place the top sheet on the bed. The center fold must be in the center of the bed and the hem even with the head of the mattress. Unfold the top sheet and straighten it over the bed. Place the blanket with its center fold in the center of the bed. Align the blanket parallel with the head of the mattress, approximately 30 centimeters below the hem of the top sheet. Unfold the blanket and straighten it over the bed. Place the bedspread with its center fold in the center of the bed. Place the bedspread in the same position as the blanket. Unfold the bedspread and straighten it over the bed. Create a pleat in the top linen at the foot end of the bed before tucking it under the mattress. This will supply sufficient space for the patient's feet. Tuck the top sheet, blanket and bedspread under the foot end of the bed, on the near side, and fold the corner. Move to the other side and repeat the steps on folding and tucking the top linen. Note: if a duvet is used, you will not tuck it in but let it hang neatly over the edges of the bed. Fold the upper 30 centimeters of the top sheet over the bedspread in order to make a cuff. How to cover a pillow with a clean pillowcase. Place a pillow on the bed. Open each pillowcase in the same manner as you opened the other linen. Gather up the sides of the pillowcase. Grasp the close end of the clean pillowcase at the center with one hand. Grasp the center of one short side of the pillow through the pillowcase. With the free hand, pull the pillowcase over the pillow. Adjust the pillowcase so that the pillow fits into the corners of the pillowcase and the seams are straight. Repeat these steps with the rest of the pillows. Place the pillows at the head of the bed with the open ends facing away from the entrance door. If the bed is not in use, leave the top linen closed. If the bed is used by a patient, fan fold the top linen towards the bottom of the bed. This will make it easier for the patient to get into the bed. Adjust the bed to a low position and raise one side rail if required. Dispose of soiled linen according to the internal policy of the facility. Perform a social hand wash. Ensure that the bed locker, water jug with a glass, and the call bell is within reach of the patient. Always ask the patient if there is anything else he or she needs before you leave the room. Evaluation. The expected outcome is met when bed linen are changed without any risk of cross-infection to the nurse or other patients. Record keeping. Changing of bed linen needs to be recorded according to the internal policy of the facility. Also record the use of bed equipment such as a food cradle. special considerations. More than one protective pad may be used to protect the bed if a patient is incontinent. In conclusion, it is important to indicate to you that the healthcare giver is an important role player in providing comfort and a clean environment for the patient. Whenever patient care is provided, adherence to infection control guidelines is needed to ensure that all care is safe care. Perform your tasks as per this lecture and to the best of your ability, always keeping in mind your scope of practice.